Thank you, Chair, and thank you, Paul, for the outline just now. I guess my questions really relate to the emotional burnout for staff, because often when people talk about fatigue, and I think it's been an incredibly long year for our incredible NHS and social care staff, but they're tired, they're fatigued physically and mentally, but also emotionally. And I just wondered what the wraparound support is over the next few months that you see to help them get through both the second lockdown, but also what might come afterwards in terms of tiered systems.
Well, I don't think there's any doubt that the mental health consequences of COVID are almost certainly going to last a considerably longer time than the physical health consequences for many, many people. And so it's really important that the approach that is taken takes a long-term view, because there are short, medium and long-term issues that people will be facing. So I think in the first instance, I think it's really important for people to have permission to seek help. We've heard a lot from other witnesses about workload, job control, and so on and so forth. Those are really important elements. So I think permission to seek help is going to be really key for this. Other witnesses have also highlighted the importance of clarity about future workforce arrangements. That's also important too. But at a really kind of granular individual level, can we answer the question, does every single employee of the NHS, and indeed people who are subcontracted by the NHS, and every employee of the social care system, does everyone know where they can go to get help? And I wonder whether everybody really does. And I think that's the first thing. The second thing is the managers that have, and supervisors in whichever context we're talking about, the managers have the tools to be able to spot the signs of somebody who's really struggling. And you've heard from other witnesses that many NHS and social care staff have got extraordinary levels of resilience. They thrive. Lots of people thrive on the situations that they face on a daily basis. But everybody has their limit. And does everybody know where their individual limits are? And do supervisors and line managers, are they able to spot the signs of the individual, of the person in their team who is maybe struggling? Perhaps they become a bit less social. Perhaps the consequences of this digital space means that you have your Zoom face, but you don't necessarily show your real face. So I think that's the second question. And then the third question, systematically, does each employer have the right set of metrics in place to understand the quality of well-being of their staff at this particular time? Do we know what from pulse surveys or whatever it might be, how people are feeling, and what additional tools might you need to put in place to support that? And we work with many employers across public, private and voluntary sectors, and we've seen many employers really step up to the mark in the last few months. And then finally, is there a clear pathway to access to clinical care? So does everybody know where Clare's service is if you're eligible for that? If you're not eligible for Clare's service, where do you go for clinical help and support from the rest of the NHS?
And may I ask, just sorry to interrupt, just briefly on those points, just one other additional point on there as well is that one of the things that we've raised as a committee to Claire Murdoch previously is about support for NHS and social care workers' families and helping them provide guidance, but also they may well be spotting those signs as well within their mothers and wives and husbands and sons and so on. What guidance is being given to those families? But with regards to those 4 points, I appreciate that it's probably a much lengthier time than we have in the committee, but are the questions you just raised being addressed?
So on your question about families, I mean, I think there's a wider issue here, which is the very significant surge that we're seeing in terms of demand for our services from across the public. And that's just happening at the moment. Chaand, the Crisis Text Line Service, our partners in this, have seen a doubling of contacts in the last 3 weeks. Our Mind Info line saw a doubling of calls in the last 2 weeks. So that's everyone, and that's friends and family of people who are working in the NHS and beyond. And I do think it's important. We've seen services expanding their offer in companies to family members, and I think it would be great if that was able to. If some of the services that are offered through the NHS, some of the apps that have been put online, and others were extended to family members of people who are working in the NHS and
Cool.
social care. I should say I'm particularly concerned about the social care area.
Yeah.